Hello everyone, my name is Simmerdeep and my systematic review is going to be on the effect of the ketogenic diet on insulin resistance in women with polycystic ovary syndrome, also known as PCOS. Okay, so what is PCOS? PCOS is one of the most common hormonal disorders in reproductive aged women and it affects about 6 to 20% of reproductive aged women. And even though the exact cause is unclear, it is mainly driven by excess androgen production and irregular ovulation. And PCOS is diagnosed using the Rotterdam criteria, and the patient must be present with 2 out of the 3 features. The first one being hyperandrogenism, which is high levels of androgens causing excessive hair growth known as hirsutism and causing acne. The second is oligo or anovulation, which is irregular or absence of ovulation. And the last one is polycystic ovaries, which is immature follicles that fail to mature and release an egg. And these follicles will start to build up and it can cause the ovary to look enlarged. And as you can see in the diagram that I have on the slide, you can see the difference between the normal ovary and the polycystic ovary. You can see that the immature follicles are present in the polycystic ovaries and it can start to build up. So how does PCOS affect the overall health of women? So PCOS can affect the metabolic and hormonal health, as well as many women can experience symptoms such as irregular periods, excessive hair growth known as hirsutism, and they can have difficulty conceiving as well. And however, in the long term, PCOS can increase the risk for conditions such as type 2 diabetes, cardiovascular disease, and metabolic syndrome. So, insulin resistance is one of the most common metabolic features of PCOS, and it affects about 50 to 70% of women that have this condition. And this is basically when the body isn't responding to insulin anymore, and the pancreas compensates by making more insulin. And then high insulin levels stimulate the ovaries, especially the theca cells, to produce more androgens. And that's why insulin resistance can technically worsen the symptoms and can cause irregular periods, hirsutism, and can even cause weight gain in patients with PCOS, in women with PCOS. So this diagram is showing the pathophysiology of insulin resistance in PCOS. So as you can see on top of the diagram, genetics, epigenetic changes, obesity, inflammation, and how these factors can contribute to insulin resistance. And so when the body becomes less responsive to insulin, the pancreas will tend to produce more of it, and this is called hyperinsulinemia, when it's producing more and more insulin. And elevated insulin can affect multiple organs. So on the right side of the diagram, you can see the high insulin can affect the brain, the pituitary, and the adrenal glands, which increases the gonadotropin releasing hormone, the adrenocorticotropic hormone, and the luteinizing hormone. And these hormonal changes stimulate the ovaries to produce more androgens, causing reproductive problems such as irregular cycles and infertility. And on the left side of the diagram, you can see that insulin resistance also affects metabolic tissues like the fat tissue, the muscle, the liver, and it also reduces glucose uptake, increasing fat storage, and it also lowers the sex hormone binding globulin levels, and which worsens the overall metabolism. And all of these effects ultimately leads to the androgen overload shown at the bottom of the diagram. And androgen excess is what causes these symptoms. It is what causes the hirsutism, the acne, and the ovulatory dysfunction. So what is the ketogenic diet? The ketogenic diet is a high-fat, low-carbohydrate diet that shifts the body into a metabolic state called ketosis. So instead of relying on glucose, the body will burn fat and produce ketone bodies for energy. And since carbs are restricted, the insulin levels will remain low. And this is why the ketogenic diet has shown benefits in metabolic disorders such as type 2 diabetes and obesity. And as you can see from the image below, a ketogenic diet consists of 5 to 10% of carbs, 20 to 25% of protein, and mostly it's high in fat, which is 70 to 80% of fats it consists of. So, how does the ketogenic diet help women with PCOS? So, since insulin resistance plays a major role in PCOS, the ketogenic diet can be beneficial because by reducing the carbohydrate intake, it can reduce insulin levels and it can improve insulin sensitivity. And this can help regulate hormone levels. It can decrease androgen production and can also improve ovulation in some individuals. So this figure is showing the mechanism of the ketogenic diet and how it helps improve metabolic health, especially insulin sensitivity. So at the top of the diagram, you can see that when someone follows a ketogenic diet, they will have a reduced intake of carbs, which will lower glucose intake and reduce insulin levels. So in response, the liver will produce ketone bodies like beta hydroxybutyrate, which will become the body's main energy source. And on the right side of the diagram, you can see that there's going to be an increase in fat oxidation so the body will be burning fat for fuel, and this will help lower triglyceride levels and improve mitochondrial function. And towards the left side of the diagram, you can see that there's going to be also hormonal and appetite changes. So there's going to be lower ghrelin. There's going to be also lower glycogen and water storage in muscles, which contributes to early weight loss. And towards the center, you can see that lowering insulin and lowering glucose results in reduced inflammation. And so towards the bottom, you can see that fat being used as fuel, lower insulin, reduced inflammation, and increased ketones can all contribute to weight loss and can also improve insulin sensitivity. So this is why the ketogenic diet can be beneficial for women with PCOS. So the aim of my systematic review is to evaluate how effective the ketogenic diet is at improving insulin resistance in women with PCOS and determining whether the ketogenic diet can help improve metabolic function or not, and if it makes a difference in women with PCOS. And these are the references that I used for my presentation and for my systematic review.